Hey everyone, welcome back to the Deep Dive. We're all about getting you up to speed on stuff that matters, and today we're going deep on omega-3s.
Omega-3 dietary supplements, right? Yeah.
Exactly. We're cutting through the noise to uncover what these supplements really do for your health. We'll be focusing on EPA and DHA.
Those are the big players when it comes to omega-3s.
Absolutely. We want to give you actionable insights and maybe uncover some surprising facts along the way. So, ready to dive in?
Let's do it.
All right, so first things first. Our sources are really highlighting the impact of omega-3s on triglyceride levels. They seem to be able to reduce those levels significantly.
Yeah, that's a big one, especially for anyone concerned about heart health. Triglycerides, those are a type of fat found in your blood,
Right, and having high triglyceride levels can increase your risk of heart disease.
for sure. The research we looked at suggested that omega-3s can actually change how liver enzymes work, which in turn can really bring those triglyceride levels down.
That's interesting. And it seems like they might help lower blood pressure too, particularly for people with hypertension.
Yeah, that's right. So we're seeing potential benefits for both blood pressure and blood fats.
Okay, but it's not just about those specific markers, right? There's this whole thing about the anti-inflammatory effects of omega-3s.
You're right. The anti-inflammatory aspect is huge because inflammation is actually a major contributor to heart disease.
So by reducing inflammation, omega-3s could be playing a role in lowering that overall risk of developing heart problems.
That's the idea. And these benefits, the anti-inflammatory properties and the importance of DHA specifically, they go beyond just the heart. We see a similar connection with brain health too.
Now, you mentioned DHA, and that's something we see popping up a lot.
It's a major structural component of the brain, so it's kind of a big deal.
So when we talk about omega-3s and brain function, what are we really talking about in terms of benefits?
Well, the research suggests there's a strong link to cognitive health, and some studies even point to omega-3s playing a role in mood regulation.
Really? So we're talking potentially helping with things like depression and anxiety.
Yeah, some research points in that direction. It's something a lot of people struggle with, so that potential benefit is definitely worth noting.
Absolutely. Now, shifting gears a bit, let's talk about eyesight. We see DHA playing a big role here too, right?
Yeah, it turns out DHA is a major component of the retina, which is obviously crucial for vision.
So how does that connect to omega-3 intake? What's the takeaway for our listeners?
Well, if you want to maintain good eye health as you age, having enough DHA seems pretty important. In fact, the research suggests that a good intake of omega-3s could actually reduce the risk of developing age-related macular degeneration, AMD.
Oh, right. That's one of the leading causes of vision loss in older adults, isn't it?
It is, so that's a pretty significant potential benefit.
It really is. Now, we talked about the heart, the brain, the eyes. What about joint health? There's been some buzz about omega-3s helping with that too.
Yeah, for people who have rheumatoid arthritis, which is a condition where the joints get inflamed, there's evidence to suggest that omega-3s could offer some relief.
In what way?
They might help reduce joint pain and stiffness. That's a pretty tangible benefit for folks dealing with that condition.
Definitely. And for anyone thinking about starting a family or who are expecting, omega-3s seem to be especially important during pregnancy.
You're absolutely right. They're essential for the baby's brain and eye development while they're still in the womb.
So getting enough omega-3s during pregnancy could have long-term benefits for the child.
Potentially, yes. And, what's also really interesting is that omega-3s might play a role in skin health, too. They seem to help keep the skin hydrated, and there's even some suggestion that they might offer some protection against sun damage.
Wow, so they might help you from the inside out.
It seems that way.
We even came across some information about omega-3s potentially boosting the immune system.
Yeah, a few studies indicated that they might enhance immune responses, which contributes to overall well-being.
Okay, so for someone listening who's thinking, all right, I want to explore omega-3 supplements, what are their options? Where do they start?
Well, the most common sources you'll see are fish oil and krill oil.
And those are widely available.
Yep. And then for anyone who's vegan or prefers a plant-based option, there's algal oil. That one's derived from algae.
So there are choices for different dietary needs.
Exactly.
Okay, so we've covered a lot of potential benefits of omega-3s, but if there's one piece of advice we want our listeners to take away from all of this, what would it be?
I think the most important thing is to talk to your doctor or a healthcare professional before you start taking any new supplements, including omega-3s. They can help you figure out the right dosage and the best type of supplement for your individual needs.
That makes sense. It's not one size fits all.
Not at all.
So just to recap what we learned from our deep dive, omega-3s and specifically EPA and DHA, may offer a whole range of potential benefits. We're talking heart health, brain function, eye health, joint health, even skin health and immune support. Plus, they seem crucial during pregnancy.
Lots to consider, right?
Absolutely. And remember, all of this is based on the information we gathered from our sources. Now, here's a final thought for you to ponder as you go about your day. After hearing about all these potential benefits and the different sources of omega-3s, what area of your own health makes you most curious about exploring these supplements further? And what questions would you want to ask a healthcare professional to get personalized advice?
That's a great question to consider. Think about what resonates most with you and your own health goals.
Thanks for joining us for another deep dive, everyone. We'll see you next time.
See you then.